This here is Hugo. Let's let him introduce himself as we get to know his background and how it can relate to all of us here.
Hi everyone, my name is Hugo and I'm a truck driver. I'm 55 years old. I spend most of my days driving my truck, which can sometimes be stressful with the deadlines I have to meet. My chest sometimes hurts when I'm stressed. When this happens, I usually enjoy a cigarette to feel relaxed. I smoke a couple packets every week. My favorite part of my day is going home after a long days of work and relaxing. After long days at work, the first thing I do is grab myself a beer and a big slice of cheese pizza. I know you all see that stuff on television about eating healthy, but I'm just buggered all. After long days at work, it is the last thing on my mind to be honest. Who can resist pizza? I can't.
Now that Hugo is at the medical centre, he is able to see his doctor. The doctor measures Hugo's blood pressure and BMI. A few blood samples are also taken from Hugo for testing. The blood test will help determine Hugo's cholesterol levels.
Let me tell you the various factors that can increase the chances of a stroke occurring. These are just some to name a few. A poor diet, especially food that is high in fat and salt, like pizza, behaviours such as smoking, drinking, and exercise levels, previous medical conditions such as diabetes and hypertension, as well as family history and age. Unfortunately, you have ticked a lot of these boxes at the moment, Hugo, so it is important to keep in mind that most of these can be fixed over time. If not, then your chances of suffering from a stroke will definitely increase. With that in mind, I'm going to suggest some lifestyle changes you should adopt straight away. First of all, stop smoking. Second of all, probably change your diet. So I like to see you eating more fruits and vegetables. There has been a new food pyramid released this year, so now most of our diet should consist of vegetables, fruits, nuts, and bread. We should be moderately eating lean meat, fish, and dairy, and oils and butters should be eaten in very small amounts. You should probably drink less as well, and consider exercise. I don't expect you to run a marathon, but half an hour every day is good. Now, to help with your high blood pressure, I'm going to suggest that you take aspirin. Aspirin has the ability of thinning your blood. This prevents clots in your arteries by lowering your blood pressure. How do you feel about this? Is this something that you can commit to? Stroke can be categorized into two groups depending on the underlying problem. The first type of stroke is an ischemic stroke, which is the blocking of the vessel. This causes the most strokes, around 80 to 85%. Or there is the hemorrhagic stroke, which can cause the bursting of the blood vessels. This covers about 5 to 10% of strokes. A stroke test can easily be used by everyone, even yourself, friends, and family. You don't need to be a medical expert for this. It is called the FAST test or the FAST test, and it helps spot symptoms of a stroke. Let's run through how to do it. F stands for face. Is their face droopy, or can they smile, or is just one side droopy? A stands for arms. Can they lift both arms, or is there a weakness in there? S stands for speech. Is their speech slurred? And T stands for time. Time is critical, and if there are any of the signs above, it is time to call the ambulance.
Hugo fails to take the doctor's advice seriously, continuing with his unhealthy lifestyle. Hugo doesn't think that anything bad will happen soon, as he thinks the stroke will not happen for years. He has ignored the doctor's advice to start exercising, eating healthy, or stop smoking. These lifestyle changes are often difficult for a person to take on, but it can be the difference between life and death. Hugo ignoring the doctor's advice led him feeling very unwell for a few days. This eventually led to him suffering from a mild stroke. Here we go through the fast checklist to see if he is suffering from a stroke. F. Hugo is unable to smile. A. Unable to lift both arms. S. Unable to speak clearly. T. Time is critical, so we need to call an ambulance now. Paramedics tend to Hugo straight away, and he will now need to be taken to the emergency department of the hospital. Luckily, Hugo is still alive, but testing will now need to be done by the doctors to establish the best treatment for him. The first thing Hugo will undergo is a CT scan. The CT scan will help determine which type of stroke he has had, a hemorrhagic or an ischemic. After an MRI scan, we'll be able to determine to show the extent of the damage to the brain.
Here we can see which parts in the midbrain affect the face, the arms, and speech during a stroke. The pons in the midbrain, shaded in yellow, affects the facial muscles. The Broca's area, shaded in purple, affects our ability to speak. And the motor cortex, shaded in blue, affects the strength in our arms. Other symptoms that can occur are changes in vision, loss of balance, confusion, or memory loss. The effects may range from severe to barely noticeable. These effects may be mitigated if proper treatment or response is provided, which is why timing is critical.
Treatment for a stroke depends on whether it is an ischemic or hemorrhagic. For an ischemic stroke, a long flexible tube called a catheter is put into the upper thigh and threaded to the tiny arteries of the brain. The doctor can deliver medicine through this catheter to break up a blood clot in the brain. For a hemorrhagic stroke, the first step is to find the cause of the bleeding in the brain and then control it. They can't be treated with medicines or blood thinners. This is because these medicines can make bleeding worse. Aneurysm clipping is done to block off the aneurysm from the blood vessels in the brain. This surgery helps prevent further leaking of blood from the aneurysm. It can also help prevent the aneurysm from bursting again. There is stroke rehab available to help patients regain their lost skills and to learn to compensate for damage that cannot be undone. The goal is to help restore as much independence as possible in the patients in regards to speech and physical therapy. Most of us often think that we will never get a stroke, so we choose not to address this issue as much as we should be. Let's look at some statistics to see what the chances are of us suffering from a stroke if we choose to not change our lifestyle habits. This video highlights the consequences of an unhealthy lifestyle. Simple lifestyle changes drastically affects the chances of a stroke occurring. The easiest changes that can be made are diet and physical activity.